So people ask me, they say, Brother Andy, why do you get so worked up about this IEP business related to literacy and students with reading disability, moderate, mild to severe? And I say, undo them, because I see the actual kids in my literacy center who have been beat up by the system that doesn't meet their needs, that have been successful only in failure. And it's caused by a lack of knowledge related to literacy instruction and the literacy process. Now, this is what I would like to see on an IEP, what I think is important related to literacy. We do need some quantitative score related to the grade level they're reading at or percentile ranking, so we can put it in context. Grade level is important so that we can set appropriate goals and levels of instruction. Standardized tests are good, but they are limited. They do not provide diagnostic assessment. Even though they claim to give you breakdowns of comprehension, fluency, etc., they're not usually very valid or reliable. You need a diagnostic assessment individually given, like the quantitative reading inventory, informal reading inventory, or some related type of miscue analysis. This provides a more authentic analysis of a more authentic reading situation. Remember, 3 causes of reading disabilities or troubles: word identification, fluency, and comprehension. As you are listening to students read individually using the quantitative reading inventory, you can hear or see exactly the types of miscues they are making. You can hear or see exactly their fluency level. Now, some tests, such as DIBELS, which is rotten, bad, are not authentic because they ask you to identify a list of words in isolation, not in context. That is not an authentic way of identifying words. It takes away 2 of the cueing systems. Now, if you want to do a miscue analysis, you can use any graded reader for this. Simply find a reader, listen to the child read, and mark the types of mistakes, words per minute, etc. I would encourage you to think about using the quantitative reading inventory because it provides good instruction on how to do it. Now remember, not all reading disabilities are the same. Depending on the cause, you need different types of instruction. Now on the gosh darn IEP, it says you need a statement of needed special education and related services based on peer-reviewed research. So you have to have a statement that describes how the child will appropriately advance toward or attain the annual goal. So you need some specific strategies related to the diagnosis. That's why we need to know. Not just they have a problem, here's average, they're below average, but we need to know. Is it fluency? Is it word identification? Is it comprehension? If it's word identification, what types of problems are giving them? Types of things are giving them problems. Remember, there's our gosh darn 3 causes. I'm going to drill that into your head. If it's word identification, remember that we use 3 types of word identifications, not just phonics, semantics, and syntax. Well, how do you measure word identification? One way to do it would be to look at the number and types of errors on a graded reader, using the IRI or qualitative reading inventory or any graded reader. You can then figure out percentages of words correctly identified on a reading passage. A passage enables the reader to use all 3 cueing systems, not just phonics, like a list of words on the stinking DIBELS test. So if I were the grand prix of the universe, a goal related to word identification would be students will identify, insert percentage here, on a reading level blank passage. All right? And here are some specific strategies specifically for word identification. You can find them in this book. But if I see an IEP coming through, I want to know, what's this teacher doing for word identification? Simply saying Orton Gillingham doesn't tell me anything. What about fluency? How do you measure? You measure words per minute. and it should be on a graded reader, so I know it's words per minute on reading level 3 or reading level 4. But then you need to listen to that child read to see what types of errors the child is making. And the goal should be words per minute on a graded reader. Here again are just some of the strategies specifically related to fluency. These, by the way, are research-based, based in research to support them. I want to see these on an IEP. Otherwise, how do I know what you're doing? And then comprehension, creating meaning with print. How do you measure? Here's where you can have scores on a standardized test. It is appropriate as long as the scores are related to comprehension and comprehension only. And there are many ways to assess comprehension. Standardized tests should be just one of several ways. The quantitative reading inventory gives you a very approximate comprehension measure, but all measures are approximate because your ability to comprehend is related to your knowledge of the subject or vocabulary words. So the goal can be standardized comprehension measures, normative scores, criterion reference scores, or story retelling scores. So, strategies for comprehension. Know that to teach comprehension, you are teaching cognitive processes, thinking processes related to comprehension. You teach the process to develop the skill, so they do it automatically as they read, automaticity. In here are cognitive processes related to narrative text, and we do narrative text different than expository text. That's story, informational text. Here are cognitive processes related to reading a textbook. And again, you can get my textbook and you see a bunch of strategies there. Here are other strategies. I want to see the specific strategy. All right, big ideas. If you're going to go through all the trouble of writing up an IEP related to literacy, why don't you actually write one that works? All reading disabilities are not the same. Standardized test scores do not sufficiently diagnose. You need to have a diagnostic assessment so that we know the cause of the deficit. It's one of those three things. Instruction should be based on the diagnostic assessment. One size does not fit all, no matter what you're doing in education, especially literacy. All reading disabilities are not the same. Goals and benchmarks are wonderful things, but they're little use without knowing how to get there. That's why we need specific strategies in IEPs for literacy. In general, special education teachers need much more knowledge and skills related to literacy. That is 70-80% of what teachers of students with learning disabilities deal with. Also, teachers of students with DCD. Special education teacher preparation programs need much more related to literacy instruction. However, we cannot create a finished product in 4 semesters of undergraduate teacher education. We need much more professional development for special education teachers. You cannot expect to be a master teacher in 4 semesters. So here's the thing. Do you really care about students with reading disabilities? Do you want to do something? Well, there's talking and there's doing. Less talk, more do. We can do it better.